Hi, I'm Corey Ann from the Molson Park Dental Office, and I'm here today to discuss the hidden dangers of sleep apnea and snoring. Are your patients being tested by sleeping with someone who snores, snorts, gasps, and stops breathing during the night? These people who share sleeping space with these ones are feeling frustrated and are suffering as well, and oftentimes find themselves not being able to sleep in the same room as their partners due to snoring. After all, most people did not get married imagining they would sleep separately. It can and does put extreme pressures on a relationship, married or not. What exactly is sleep apnea? Sleep apnea means to stop breathing. It refers to a condition where you stop breathing during sleep. Most of us know someone who snores. And while snoring is often made the subject of jokes and teasing, it could be an indication of a serious problem. The severity and dangers associated with sleep apnea ranges from snoring, which happens when your throat and tongue tissue relax enough to narrow your airway. Snoring is the sound that is produced when air passes through the partially blocked area, causing the tissues to flutter or vibrate. Also, if the jaw is too small to accommodate the tongue has a tendency to fall back, further restricting your airway, causing snoring and apnea. In more severe cases, when sleep apnea occurs, you literally stop breathing for 10 to 15 seconds or more, causing blood oxygen levels to fall, forcing the heart to work harder. Your brain starts to panic. It's like someone is trying to put a pillow over your face and you are suffocating. This feeling forces you to wake up. That's if you're lucky. Some people aren't as fortunate. This is what often happens when you hear people say they died peacefully in their sleep. Disturbances in the sleep cycle can cause high blood pressure, obesity, heart disease, gastric reflux, depression, and memory loss. Some studies have shown similar brain function or pattern to those who suffer from Alzheimer's due to the lack of oxygen. More common signs and symptoms of sleep apnea include snoring, waking up tired, dry mouth, difficulty concentrating, fatigued, weight gain, irritability. Diagnosis of sleep apnea should start with a medical evaluation. For cases of severe sleep apnea, continuous positive airway pressure, also known as the CPAP, is often the first choice, which means wearing a mask while sleeping. This maintains a positive air pressure, pushing air into your lungs. However, properly trained dentists can also make custom-fitted oral appliances that are worn over the teeth at night to prevent the jaw from falling back during sleep, keeping the airway open. At the Molson Park Dental Office, we utilize the TENS unit and the Case 7 computer jaw analysis software to ideally position the jaw to fabricate an oral appliance called the mandibular advancing device that assists breathing during sleep. Obstructive sleep apnea is considered a disease of craniofacial anatomy, so the onus is on the dentist to identify and help manage sleep apnea sufferers. For a more restful sleep, ask your dentist or the staff at the Molson Park Dental Office about the Micro 2 appliance today.